alongside our wonderful COP-RCORP team. Before we get started, I would like to let everyone know that today's session will be recorded and uploaded to the COP-RCORP website, along with the PowerPoint slides. We would love for you to share this learning opportunity with others who are not able to attend today. We will send the learning links along about a week from today's session. I would also like to acknowledge the HRSA grants that have made this learning opportunity possible. And I would like to state that the content are solely the responsibility of the authors and do not necessarily represent the official views of HRSA or the U.S. Department of Human Health and Services. For our agenda today, we will be doing some opening and housekeeping, presentation, Q&A, and then our closing and evaluation link. As a reminder, please remain until the end of the presentation to fill out the evaluation for your CE certificates. For our opening housekeeping, for attendance, please enter your name into the chat. If you are seeking prevention or CHES CEs, please include your license numbers with your name in the chat at the start and end of each session. As a reminder, you must attend at least 90% of the session and complete an evaluation within 4 days of the session. Failure to provide required information or meeting attendance may result in a lack of a CE certificate. I would like to say thank you to our participants, community partners, presenters, and planning and leadership team for putting together this project. Here you can see some of the wonderful members of our COP-RCORP team. This photo was taken during the 42nd COP-RCORP Consortium meeting at Fairfield County on June 18th, 2024. So let's learn a bit more about COP-RCORP. The Communities of Practice Rural Opioid Response Program is a multi-community consortium that includes the Pacific Institute on Research and Evaluation, PIRE, the Ohio University School of Leadership and Public Service, and 4 Ohio counties and partners. These partners are Ashtabula County Mental Health and Recovery Services Board, the Fairfield County Adams Board, the Sandusky County Public Health, and the Mental Health and Recovery Board of Seneca County. Each county has a community-specific consortium that leads projects and activities within the communities. We are grateful to HRSA and all the state-level partners that support the work of COP-RCORP. Here we have our QR code for more information about COP-RCORP and the work we have done since 2018. Please visit our website by scanning the QR code or copying the link that you see here. And I will give everyone a moment to do so if interested. All right, so moving on. Why are we exploring xylazine misuse and prevention? Well, in response to increases in xylazine found in our testing from our COP-RCORP has reported, we are hosting this virtual learning event focused on xylazine awareness, prevention, and harm reduction, available to our local community. Please remember to keep your audio muted during the presentation, as we will have time for discussion at the end of our presentation. I would like to introduce our 4 lovely speakers today, who are all research associates of the Michaels Lab located at Nationwide Children's Hospital. Today, we will be hearing from Aleah, Jacob, Maddie, and Natalie. Let's see, and I will now hand the presentation to our speakers.
All right, thank you very much for that introduction, Madison. And can everyone hear me? Excellent, okay. My name is Jacob Holycross, and I work at Nationwide Children's Hospital. And if you're here for the Exploring Xylazine Use and Prevention webinar, then you're in the right place. To start us off again, as a little bit of introduction background for each of us. Again, we all work at Nationwide Children's Hospital in the Center for Injury Research and Policy, and we all work under our principal investigator, Dr. Nichole Michaels. We have all been collaborators and colleagues on a couple of fentanyl test strip, statewide Ohio-based fentanyl test strip studies. So I'm going to get us started off here, and then we'll hear from Aleah, and then Maddie and Natalie later on. We want to thank Ohio University's Voinovich School of Leadership and Public Service, and we also want to say that we have no conflicts to disclose. Our objectives today are to give an overview of xylazine use risks and prevalence in the United States, a summary of state and federal actions regarding xylazine use monitoring, and a discussion of strategies to address xylazine use within communities. We did put a note in here about language, so when we presented this to colleagues, this came up, but we wanted to say that we, the presenters, do our best to acknowledge and utilize terminology that respects the dignity of people who may use substances. Published objectives for this event use the term misuse, which our colleagues noted to us carries a stigmatizing connotation. For the presentation, we want to recognize that any use of substances does not devalue people. Therefore, we refrain from using misuse unless we were referring to sources that use this term in a way to avoid intentionally contributing to stigmatization. All right, now let's get started with the actual content here. So xylazine risks and prevalence. A little bit of background on xylazine. It was discovered in 1962 by the Bayer Pharmaceuticals and promoted as an antihypertensive drug. However, the effects on blood pressure and the central nervous system in humans kind of ruled it out for clinical use. But xylazine is an analog of clonidine, which many of you probably know is an FDA-approved blood pressure drug. Clonidine is also used in the treatment of ADHD, Tourette syndrome, controlling cancer-related pain, and an adjunct therapy for neonatal abstinence syndrome. But due to its limited use, we started to see in the late 1960s that xylazine was being introduced into veterinary practice, and it began to be used as a tranquilizer for animals, of course. Current liquid concentrations for xylazine include 20 milligrams per milliliter all the way up to 300 milligrams per milliliter. A special note that toxic concentrations in the literature report that xylazine can be fatal in doses that are detectable only in trace amounts and up to 16 milligrams per liter in blood plasma. So if you do a little bit of calculation here, you can, we might know that the average adult has 5 liters of blood. So if you multiply that by that 16 milligrams per liter figure I gave you, that's only 80 milligrams of xylazine is toxic or fatal for human beings. That's not very much considering the liquid concentrations are, available in milliliters. So it doesn't take much for toxic effects of xylazine. The first detection of xylazine known street drugs was in Puerto Rico in 2000, and then later infiltrated in Philadelphia in around 2007 and was known by them as tranq. So the mechanism of xylazine, I'm not going to try and get too into the weeds here on this, but the mechanism of xylazine and how it affects the human body. So it's an alpha-2 adrenoreceptor agonist, which basically means that there are certain nerve cells in the body that it has a high affinity for. So the figure shows the mechanism of xylazine on nerve cells. Xylazine works by activating a negative feedback loop, inhibiting the release of norepinephrine, which is causing those sympathetic effects. So it will, decrease blood pressure, decrease your heart rate. Xylazine can activate the alpha-1 receptors on the other side of the synapse, causing sympathomimetic effects. So that would increase your blood pressure or heart rate. But it has a higher affinity, like I said, for the alpha-2 receptors, making these effects more pronounced. In animal models, high doses of xylazine have caused hypertensive emergencies, strokes, and heart attacks. A high from xylazine can last up to 6 hours, depending on, of course, the dosage, route of administration, and combination with other substances. But the overall sedative effect of xylazine can begin within minutes and last longer than 8 hours. Another special note, there are drugs out there, so you may have heard that there is no antidote for xylazine, but there are alpha-2 antagonists, which are antidotes to xylazine, that are out there, but they are, of course, not used clinically in humans. They're not FDA approved. So there's just a couple of drugs that I listed there. One has been approved for use in dogs. And then our next slide is going to contain some graphic images because we're going to talk about wounds related to xylazine use. So I just wanted to prepare everyone for that. So as you can see here, xylazine use has been associated with wound development and all across the body, some really bad ulcers, some that are just more like lesions. And we're actually going to get off the graphic slide here and talk about it more in depth on this slide. So these ulcers that are associated with xylazine use all come from case studies in the literature currently. There's very little epidemiological data, so the mechanisms for xylazine as the causative agent have not been proven yet. In their study, Reyes and colleagues observed 89 Puerto Ricans. They surveyed them about xylazine use and conducted focus groups for details of use, consequences, and utilization awareness. So these skin lesions, which they did not define in paper, were reported by more than 1/3 of respondents, but not directly at injection sites. Many lesions were on the legs. As you probably know, many people that inject substances don't typically do it in their legs. Authors propose a decrease in skin oxygenation, leading to exacerbation of new or existing wounds. So this is a quote from the paper. The continued consumption of xylazine at unknown doses could progress skin oxygenation deficit, contributing to chronic skin ulceration. The majority of respondents, though, in this study reported xylazine use in a speedball, which is a mixture of cocaine and heroin. So as the third statement there says, polysubstance use, and then of course non-sterile injection confounds the data, and of course that presentation in emergency settings as well. The authors acknowledge this is a limitation that, quote, inferences that can be made with respect to the establishment of a causal association between xylazine use and its health consequences. In an earlier study conducted by Rodriguez and others, syringes were collected from people who use drugs and short interviews were conducted. Staff recorded if participants had visible skin ulcers and asked participants when they could not see the ulcers. Among xylazine users, there was only 39 in their sample. 39% of those had skin ulcers, while among the non-xylazine users, 73%, only 7% did. So while these results are statistically significant, without a proven physiological mechanism, we should use caution, stating that xylazine causes skin wounds or ulcers. Again, speedball was detected in over 90% of the needles in this study. And so for clinicians or public health practitioners in general, in cases where skin ulcers are present, xylazine should be considered as a possible agent. Now, in terms of clinical signs of acute xylazine toxicity, we do know from the literature and more case studies that signs are constricted pupils, low blood pressure, slow heart rate, respiratory depression, high blood sugar, and abnormal heart rhythms on an electrocardiogram. Next, we're going to talk about xylazine as a drug adulterant, which is how it's mostly found here in the continental United States in recent years. So in their study, Silva Torres and Mosiani, they found that 95% of xylazine-involved overdose deaths would test positive for fentanyl or fentanyl analogs. So this drug is being widely used in conjunction with fentanyl at the same time. In their review, which was published last year, the authors found that less than half of US states perform tests for xylazine detection and are not monitoring overdoses related to xylazine. In addition, states that do not report xylazine-related overdoses are also not gathering data from all counties within the state. Now, we do have some data in the literature that is about animal models. So as you can see for this graph here, Costamares and other colleagues found that a combination of xylazine and fentanyl have shown increased lethality in mice. So this graph depicts that in the red bars here, this is just xylazine alone given to mice, and at 100 milligrams per kilo, that dose was lethal 90% of the time. And then when you go over to the purple bars here, they gave them a combination of 60 milligrams of xylazine with 10 milligrams of fentanyl. So adding only 10 milligrams of fentanyl increased that lethality of 60 milligrams of xylazine to 90% as well. So even though, of course, these results aren't generalizable to humans, it is good to know that, xylazine has these toxic effects and it does potentiate those effects of fentanyl as well. I also want to note about that study that they did give mice a pre-treatment with 10 milligrams per kilogram of naloxone and another dose of 30 milligrams per kilogram of naloxone 20 minutes before the xylazine fentanyl administration. And so in those two dosages, the 10 milligrams reduced mortality to 40%, while giving 30 milligrams of naloxone reduced mortality to almost zero. Of course, like I said, the study is not directly applicable to humans, but it is wise to take note of this information. So what I found and what my colleagues have found looking through the literature is that the clinical presentation of xylazine in human overdoses is less well known, and it's a very large gap that is being highlighted here due to low awareness and shortfalls in testing. Lastly, I want to touch on prevalence for use, mortality, and detection. So a survey sample of adults evaluated for substance use treatment between July 2022 and September 2023. Among those, there was 44,000 surveyed. They found that 4.4% of those people report ever using xylazine. Among those people using illegally manufactured fentanyl or heroin as their primary substance, those people there was 12.7% prevalence of reporting ever using xylazine. And then polysubstance use, as we stated earlier, was higher among people who had ever used xylazine. So 57% reported that versus 36% that didn't use xylazine. Important notes about this study, though, the majority of this sample, so 70%, came from the Southern United States. So results are not generalizable. The median lifetime of non-fatal overdoses was higher for people reporting xylazine usage. And the majority of respondents, about 59%, reported ingesting, snorting, or smoking xylazine, while only about 1/3, or 31%, injected it. Now, in the second study on the right, referenced the National Forensic Laboratory Information System, collects drugs seized by law enforcement and analyzed by U.S. forensic laboratories. The lack of xylazine-related mortality data echoes the findings that previously mentioned that less than 50 states are testing for xylazine and monitoring in overdose cases. So during the study period of 2019 to 2022, the authors found that only 42 states and the District of Columbia reported at least one xylazine-related overdose. But during that same study period, the reports, so those laboratory drug seizure reports, more than doubled in 30 different states. The highest overall, of course, was concentrated in the Northeast, which is where we know historically xylazine kind of entered the continental United States. And in 2022, Ohio had the 6th highest reporting rate of all these states. And then lastly, I wanted to make a note about kind of careful reporting in mainstream media. So NPR just released this article yesterday, and as I was reading it, they talked about xylazine, and this quote jumped out at me. It says, "Xylazine causes severe wounds on people, but it requires a large amount of it to be fatal. A sharp contrast with fentanyl, which can be deadly even in tiny doses." So this quote was from a nonprofit worker in Philadelphia. Although the statement has some validity, it is erroneous to report that xylazine requires a large amount of it to be fatal. The interplay of dosage, combination of substances, route of administration, overall health of the person, and many other factors play into the dangerousness of xylazine. So even if a person does not suffer an overdose, xylazine will cause some lasting complications, and it has no treatment course at this time. All right, and with that, I'm going to pass it off to my colleague, Aleah Cumberbatch, to get us started on federal and state responses.
Thank you, Jacob. So as Jacob mentioned, now we're gonna focus on the federal and state responses to xylazine use. First, we're gonna just give a quick overview of federal drug regulation, in case there's anyone among us that probably isn't too familiar with some of the agencies or the legislation that overlooks substance use at a federal level. The two that we're going to focus on for today are the Controlled Substances Act and the Federal Food, Drug, and Cosmetic Act. Those are the two major factors or legislation that really impacts how substances are regulated across the state. We're going to try to make a distinction between the two. I'll try to make it as clear as I can. Some of it can be a little bit murky, but in terms of the role of the Controlled Substances Act, so this was created in 1970. And it was intended to help create a balance between allowing people to have access to the substances that they need for medical treatment, but also making sure that designated drugs aren't abused or they aren't used in a way that creates an unhealthy dependency. It does not regulate all substances, that should be noted. There are some substances that people think should be controlled that are not. Examples are alcohol and tobacco. Those are substances that are not regulated under the Controlled Substances Act. This act is enforced by the Drug Enforcement Administration. And now we're gonna look at the Federal Food, Drug, and Cosmetic Act to the right. This act was created to protect consumers from using unsafe or ineffective drugs. All pharmaceutical drugs are subject to the FD&C Act, and it is enforced by the US Food and Drug Administration. Just to note in terms of the distinction between the two, so when you think of the Controlled Substances Act, just think of it as trying to protect people who use different substances from getting into any issues with abuse or dependency, whereas the Federal Food, Drug, and Cosmetic Act, or the FD&C Act, it focuses more on protecting people from the dangers of using substances that may be ineffective or are dangerous. It should be noted that it is possible for a substance to be in or to be regulated by one act and not the other. And we'll talk about that for xylazine specifically because that is the case here. And we're going to talk now about drug classification. So the CSA Act, what it essentially does is classify drugs, different substances that are determined to need to be controlled, and they put them in different tiers, essentially. It regulates substances in one of 5 schedules, and it's usually based on medical use, potential for abuse, and safety or dependence liability. If you look at the chart on the right, and we'll go into some of the examples that are on that chart, you can see that the lower the number, the stricter or the greater the restrictions on the substance. As I said earlier, this is related to whether or not it is useful in the medical community or it has been known to be useful in the medical community, and that balance between the odds of it being highly dependent. You can also see that the DEA in that note on the left, it mentions the fact that the DEA, it is possible for them to temporarily schedule a drug based on if it's an urgent threat or not. So they can temporarily schedule a drug for up to 2 years, and then eventually they'll have to decide if they want to permanently schedule that drug. And we'll talk about a few other states or instances where we've seen that transition from a temporary scheduled drug to a permanent. It should also be noted that xylazine, as I mentioned earlier, is regulated under the FD&C Act, but not the CSA. And that is due to the fact that xylazine is not approved for human consumption. While it is, as Jacob mentioned, used in the veterinary community, it is not approved for human consumption. And so that can create some challenges in terms of scheduling xylazine. We've seen for fentanyl, it was much easier just because it has been known to be used in the medical community. For xylazine, it has not been known to be used for humans. It should also be noted that in scheduling, sometimes there can be bias, and that can be impacted by the political climate, by stigmatizing beliefs about certain substances, and whatever information is available at the time. We have seen debates about certain drugs being classified in certain categories and whether or not they should be moved or not. Now we are going to give some examples or go into some of the details of federal responses that we have seen in regards to xylazine. And we'll just do a quick little timeline. So you can see what happened is starting in about 2021, but we have some information from before then. We started to see increased awareness about xylazine being present in different drugs across the nation. In 2021, in September, the CDC shared information on the detection of xylazine in drug overdoses throughout the study. And they got that data from the State Unintentional Drug Overdoses Reporting System, or SUDRS, as some of us may be familiar with, where they accumulated information from about 38 states from January to December of 2019. And they found that xylazine positive and xylazine involved deaths were involved in 25 and 23 of those 38 states, respectively, that they got data from. We also saw the DEA playing a role in terms of creating more awareness. They published a report on the threat of xylazine with mixed illicit substances in October of 2022. And we also saw the FDA started to create different outlets to share some information with healthcare workers about patients who may come into their services needing some assistance and presented wounds, as Jacob mentioned earlier, or different complications related to xylazine use. In March of 2023, the DEA also issued a public safety alert about the threat of fentanyl mixed with xylazine. They also have had much more information and reports since then, but these are just some of the highlighted ones that have pretty much played a big role in pushing forward efforts to address xylazine use. We're also going to look at some of the regulations that we've seen. For the most part, the response has been to try to get xylazine to be scheduled. That has been where much of the effort has been focused. And so in March of 2023, the House of Representatives introduced the Combating Illicit Xylazine Act. And that act was intended to classify xylazine as a Schedule III drug. Just for context, some of the other substances that are on that tier from the chart that I showed earlier are ketamine and Tylenol with codeine. So that should give you a reference of where they were aiming to schedule it at. The thought behind trying to schedule xylazine at that level was to create that balance between allowing the veterinary community to have access to the substance, while also making sure that humans are protected from any dangers associated with using xylazine. We also saw in April of 2023, the Office of National Drug Control Policy designated fentanyl adulterated with xylazine as an emerging threat to the country. And that then necessitated a response from the president. And so in July of 2023, we saw the Biden administration present a plan to address the emerging threat that xylazine was classified as. Much of this plan focused on increasing access to testing, prevention, and overdose resources related to xylazine. It also focused on addressing the drug supply, so access to xylazine or xylazine being brought into the country. We also saw in December of 2023, the Trank Research Act was signed into law by the president, and that bill required the National Institute of Standards and Tech to support research and different initiatives or efforts related to getting more information on xylazine detection. Now, that Combating Illicit Xylazine Act that I mentioned earlier in 2023, it passed in the House, but it was not enacted. And so now that we're in a new administration in 2025, we're now again seeing efforts to reintroduce that bill. And so Congressman Jimmy Panetta reintroduced that bill here in February of 2025. It still aims to schedule xylazine as a Schedule III drug. And I'm going to wrap up on this last slide talking about responses specifically in the state. So while xylazine has not been classified under the CSA, states can still respond in different ways. A lot of states we've seen have scheduled xylazine. Some of the categories or the classifications has varied among different states, depending on their population or, as I mentioned earlier, scheduling is impacted by political climate, stigma, and such. And so in March, just to highlight some of the notable regulations, in March of 2023, we saw West Virginia pass legislation to classify xylazine as a Schedule IV drug. We also saw in April of 2023, Pennsylvania submitted a notice of intent to classify xylazine as a Schedule III drug. Jacob did mention that Pennsylvania, Philadelphia specifically, was one of those hubs when we saw xylazine first come on the scene. And so that is a notable response to xylazine for that state. We also saw eventually, I think in March of 2024, that scheduling transitioned from temporary to permanent for the state of Pennsylvania. In July 2024, Indiana also made a response, but instead of scheduling, they chose to look at penalties. So they increased the penalties for possession of xylazine. In August of 2024, the Network for Public Health Law found that 20 out of 50 states allow all forms of drug checking equipment to be sold, given away, or possessed. As Jacob mentioned, less than half of the states allow drug tracking equipment. And this is a resource that we need for individuals because we don't want to assume that everyone that uses xylazine is intentionally using it. And so some people would like to be aware of whether xylazine is in the substances that they use. And so having this resource available goes a long way in terms of allowing people to make that decision on their own of whether or not to use the substance they have or what harm reduction strategies they should use. The chart on the left shows states with laws permitting free DCE or drug checking equipment. This shows specifically allowing drug drug check-in equipment to be distributed. So you'll see Ohio, I know the chart is kind of tiny, but you can see Ohio is among one of those states. Unfortunately, while drug check-in equipment across the board is permitted to be distributed in Ohio, possession still is an issue in the state where it is not allowed that xylazine or other test strips other than fentanyl can be possessed by individuals. And quickly, I'll just talk about some initiatives that have been brought to fruition that we've seen have been useful in terms of addressing this issue. So Rhode Island launched a program to help with creating prevention centers where people can use substances safely. We also saw Maryland establish a statewide drug check-in program where they allowed people to safely come into syringe exchange program, services programs, and they can have their substances checked or their paraphernalia checked by professionals who know how to use that drug check-in equipment. That also allowed the state to gather some data about trends in substances that are arising on the scene. New Jersey also responded by creating a harm reduction centers across the state, and those focus on teaching information or sharing information on injection practices that can be safer. And it also trained nurses on how to respond to wound care. So all of those, all that information, I know it is a lot, but from that, I hope that you gain the understanding that there is a lot to be done in terms of actual practices that can be implemented. And I hope that you also feel challenged to be aware of some of the unintended consequences of legislation that can affect populations such as people who use drugs and the impact that has on their daily lives. And so we're going to now turn it over to my colleague, Maddie, who's going to give some more information on state responses.
Hello. So like Aleah said, I'm just going to go into some specifics of what other states are doing. So you've probably heard of Good Samaritan laws. They exist to offer legal protection to people who give assistance to people who are injured, ill, or in danger. And they generally encourage bystanders to offer assistance and reduce hesitation due to fear of legal action. So Good Samaritan laws exist in a number of states, but they vary depending on what kind of protections are included in them. So the study found that Good Samaritan laws with protections from arrest in conjunction with naloxone access laws were associated with a 7% lower rate for all overdose fatalities. Like Aleah mentioned about drug checking services, they vary in legality across states, but this study in Rhode Island looked at one drug checking service and found that it can increase awareness and engage at-risk individuals in prevention, harm reduction, treatment, and rapid care for xylazine-related wounds. So drug checking services involve consensual collection and testing of small amounts of drug samples and often promote harm reduction behaviors and linkages to care. And like we mentioned, it just allows people to ahead of time know what's in their substances, because often xylazine use is unintentional, which was one of the findings of this study. Another finding was that it was exclusively in samples expected to be fentanyl. And with the absence of drug checking services, people rely on just observing the health effects that they experience, such as sedation and wounds that maybe they haven't seen before. And this gives them the power to understand what is in their supply. Another study that looked at communities in Massachusetts, specifically at post-overdose outreach programs, which target people who have survived overdoses recently, because we know that people who have recently overdosed are more likely to overdose in the future. So this study found that when those programs provided or referred survivors to social services, it potentially helped survivors and their family meet concrete needs, thereby reducing overdose. We know that economic downturns, unemployment, and poverty increase one's risk of overdose. So it makes sense that by meeting these basic needs, that is reduced. And some of these services are things like housing, employment, education, and transportation services. And lastly, the study that I have on here is from Brandeis University. They worked on a project with the purpose of planning a collaborative response to xylazine. So they worked with a number of professionals who work with people who use drugs. A major focus was the police, and they did webinars, in-person focus groups, and interviews. And although we are not able to see how this impacted overdose rates, they did find that people who use drugs emphasize the importance of police and EMTs being educated that naloxone does not reverse overdoses. And they also expressed interest in receiving xylazine test strips. Also, like Aleah mentioned, Rhode Island was the first to open a state-sanctioned safe consumption site. This allows people to bring their illicit supply and use under supervision with trained professionals who are able to respond to an overdose. And often there's a number of other resources there that are available. So now I'm going to talk about regulation by the state of Ohio. So although xylazine is not federally scheduled, it is scheduled by the state of Ohio. In March of 2023, Governor DeWine signed an executive order directing the state of Ohio Board of Pharmacy to immediately classify xylazine as a Schedule III controlled substance. Ohio was one of the first states to do this, and following this order, vet practices and other drug distributors were able to obtain temporary waivers to limit disruptions and ensure compliance. And in the meantime, those practices and entities were able to obtain a license that allows them to continue to obtain xylazine and continue to prescribe it to clients to give to animals. And we have a pretty good understanding of classification from Aleah. So we're also going to talk about some of those implications. It will inhibit clinical research. There is current research going on, including cancer research, that will be disrupted due to the classification. And there's already future research needed on the safety profile, toxicology, and health impacts of xylazine. That classification will cause a barrier to. It can also deter those seeking care for xylazine use due to fear of arrest, even if use was unintentional, even if someone is unsure whether they have recently ingested xylazine or not. Just the knowledge that they could face legal actions for doing so could deter them from seeking care, whether that's in the setting of an overdose or just seeking care for a substance use disorder. It's also important to note that fentanyl already has severe criminal penalties, and xylazine is predominantly found in conjunction with fentanyl. Not to mention that incarceration can increase one's risk of an overdose. And we can use Florida as a bit of an example because they made xylazine illegal in 2018, yet there was a dramatic increase of 1,127% in xylazine-involved overdose deaths from 2020 to 2021. And we know that generally just from the history of drug policy, we know that with greater prohibition, the supply side of the unregulated drug market can become more potent and more inconsistent, heightening health risks to people who use drugs. This is summed up well in this quote by Alex Krotulski at the Center for Forensic Science Research and Education. He says that history has repeatedly shown that the scheduling of drugs or related substances opens the door for new replacements, those of which are sometimes more potent, more harmful, and more difficult to track. The adulteration of fentanyl with xylazine is occurring deliberately to improve the effects of fentanyl. If xylazine was removed from the drug supply, it would almost certainly be replaced by another drug, possibly a benzodiazepine, which could lead to worse overdose outcomes and health implications. And this same trend gave rise to xylazine. When restrictions were placed on prescription opioids, people turned to the underground heroin supply, and then subsequent crackdowns on heroin prompted the rise of fentanyl, and harsh fentanyl penalties fueled an explosion of fentanyl analogs. So now I'm going to pass it off to my colleague Natalie to go over a snapshot of xylazine awareness and attitude.
Hello. As my colleague Maddie said, I will be going a little bit more into xylazine awareness and attitudes, as well as highlighting some of the work done by members of our lab, a little bit more info on xylazine effects, and also overdose response. So to begin, this was a study done by members of our lab, Dr. Nichole Michaels, Suroj Bista, and Ashley Short Mejia. It was done kind of in conjunction with one of our other ongoing studies. That study works specifically with Project Dawn sites. For those that are unaware of Project Dawn, it is a network of naloxone distribution sites, commonly like health departments, other community grassroots organizations, syringe service programs, things like that. So they were recruiting participants from there, and about halfway through that study, questions related to xylazine were implemented in the baseline survey. And in total, 630 participants were recruited. Important to note, qualifiers included the participant had to have used an illicit stimulant within the past 6 months, over the age of 18. And again, they were recruited from Project Dawn sites. So the median age of those participants was 42 years, and the range is shown next to it. Predominantly male at 59.1%, and also predominantly white, European American or Middle Eastern at 65.1%, followed by Black or African American. A majority were also not Hispanic or Latino. Other demographics were collected, including whether or not they were currently experiencing some form of homelessness, and about 39.8% were experiencing some form of homelessness. Again, participants were recruited from Project Dawn sites throughout the state of Ohio. Of those sites, 78.6% were recruited from urban places and 21.4% from rural places. And then here is one of the questions added to that survey, the baseline survey. Before today, have you ever heard of xylazine being present in street drugs? And members of the lab also made sure to include other names for xylazine, including trank dope, Philly dope, sleep cut, or zombie drug. Of the 630 participants, 53.5% responded that no, they had never heard of xylazine being present, while 46.5% responded that yes, they have heard of xylazine being present in the supply. Important to note again, people who are accessing community resources such as these Project Dawn sites may be more likely to be aware of changes in the drug supply or have access to incoming information. So that's just something to keep in mind as I talk a little bit more about the findings. And then here are a couple other questions. These were asked to people who were aware of xylazine before the survey, so 293 out of the 630 participants. First question, how do you feel about using xylazine? 73% responded they do not want to use xylazine and try to avoid it. 14.3% responded they do not try to use xylazine, but they're not worried about it being in their drugs. And then 5.5% and 4.4% responded either they use xylazine when it's available, but it's not the first choice, or I would rather use xylazine than other drugs. And there are potentially a variety of reasons for preferring xylazine. It is known that xylazine does enhance the effects of the drug it's used with, in most cases fentanyl, but members of our lab are actively investigating further into the attitudes among people who use drugs in relation to xylazine. And then another question, how important is it to know if xylazine is in your drugs? 44.4% responded it was extremely important to know. 31.4% responded it was very important. And then it just goes down to moderately important, slightly important, and not important at all at 6.5%. And then here I will discuss strategies to address xylazine use. On this first slide, I will just go a little bit more into effects and symptoms of xylazine. So one of the, main symptoms that a lot of people are talking about is the prolonged sedation. People may be sedated for upwards of 4 or more hours, in addition to being confused or disoriented. This alone is a safety hazard. People who aren't aware of their surroundings are prone to potentially more danger, depending on the environment. Also, other symptoms including respiratory depression or a slowed breathing rate, slowed heart rate, lowered blood pressure, wounds, as Jacob was talking about earlier, skin ulcers or abscesses, and then another symptom being severe withdrawal symptoms. On the right side of this slide, there is kind of steps for responding to an overdose. None of this is medical advice, but just recommendations from the CDC. First, check to see if the person can respond. Monitor their breathing. If they are not responding, it's recommended to call 911. People are not obligated to state why they're calling. You can just say that a person has stopped breathing or they're not responding and you need help. The person, depending on the situation, the 911 operator, may instruct people to begin CPR depending on the training level of the person calling or things like that. It's also recommended to administer naloxone to the person. Again, naloxone only works on opioids. It's not going to work on xylazine, but because xylazine is often, fentanyl is often contaminated with xylazine, it may reduce the effects that fentanyl has on the overdose. After that, administer rescue breaths, lay the person on their back, tilt their chin up, and then breathe 2 slow breaths into their mouth. And you want to see their chest rise and fall with each one. Again, checking their breathing throughout this whole process. And then after that, it's recommended to give 1 breath every 5 seconds, and then stay with the person until EMS or other medical personnel arrives. Then over here, so findings for the study done by members of our lab and other work also pointed to a need for increased xylazine awareness among people who use drugs. When addressing this, it's important to do your best to reduce stigma, avoiding stigmatizing language and kind of meeting people where they are, and also encouraging safe use practices, which I will talk about in the next slide. Also, preparation of pamphlets and other educational materials alongside existing harm reduction programs, so that people who are accessing these programs can hear about xylazine and potential dangers of it, highlighting effects and symptoms, and also pointing to other community resources. And then also it's important to include first responders and other health providers when increasing community awareness, because they may be some of the first people to interact with, xylazine overdoses. Initiate conversations with patients about changes in the drug supply or risk factors, and facilitate referrals if needed to treatment programs. Also keep xylazine in mind when responding to overdoses. If naloxone isn't seeming to do anything, keep in mind that xylazine may be at play, and also emphasize the need for rescue breathing, in this case because of the drastic respiratory depression. And then over on this slide has recommendations for safe use from the CDC. Never use alone, use with someone you can trust so that they can call for help if needed. That number, 877-696-1996, is the Never Use Alone hotline. It's a national hotline, so that people, if they don't have someone physically present with them, can stay on the line with someone that can call for help if needed. Use in a safe environment. This may not always be possible for people, but again, having someone that you can trust to be there to kind of monitor you. Or Ohio doesn't have this yet, but in those states, like Aleah was talking about, Rhode Island with those safe use centers, using somewhere like that so you can be monitored while using. Also, always carry naloxone, again, to reverse any effects caused by fentanyl in an overdose. Treat those wounds as they occur, which in the next slide have basic wound care instructions. Also reducing the risk of infection when using, so rotating injection sites, or using sterile needles if accessible, and then if available, testing substances. And then lastly, this is just basic wound care, again, not medical advice, but from the Oregon Health Authority on how to treat wounds as they appear. It's emphasized to keep wounds clean, moist, and covered. Those are kind of the 3 basic instructions. Wash your hands with soap and water before dealing with a wound, and gently rinse the wounds every 2 to 3 days. Apply a barrier ointment like petroleum jelly onto gauze, and put that gauze over the wound, putting another layer of gauze, and then wrapping with a bandage. If possible, changing the dressing daily. Also, avoid cleaning with alcohol or hydrogen peroxide. A lot of people kind of jump to these to clean any, cuts, abrasions, things like that. But in this case, they may dry out the wound more. And again, we want to keep it moist. And then lastly, always seek medical advice if wounds become infected or change in appearance. I put some symptoms of that a little bit to the right: increased pain, loss of mobility, exposed bone, skin tissue falling off. And then just those images are just some of the things like dressing, gauze, petroleum jelly. And then I will hand it back to Maddie.
So just to conclude, we have some things you can be talking to your legislators about, looking out for when you're voting in local and state elections, and just talking about in your community things like expansion of overdose prevention services or the addition of things like drug checking and xylazine test strips, comprehensive Good Samaritan laws with specific protections from arrest and things like that, increase access to medication for opioid use disorder and naloxone, and evidence-based drug education and treatment, specifically for people like first responders, clinicians, and others involved in the care of people who use drugs. And of course, we need more research to be able to provide more education and treatment protocols. So just to summarize, our key points: evidence is not conclusive. We need more research and information on xylazine's effects on humans and the causes of wounds related to using the drug. Xylazine is not safe for humans and can have dangerous effects when used by itself or in combination with other drugs. Most of the federal and state responses to xylazine use have been policy related, specifically scheduling the drug. So states should continue to explore new evidence-based approaches to address this issue, including increased harm reduction services. And in overdose cases, xylazine should be considered among possible substances to have caused the overdose. Although naloxone does not reverse the effects of xylazine, it should still be administered because of high polysubstance occurrence. And we just want to thank our principal investigator, Nichole Michaels. We are all a part of Dr. Michaels' lab. We want to thank her for allowing us to do this type of research. And if you just Google Nichole Michaels' lab, you'll see our page and you can see what things we're working on. Also, in the slides that will be provided to you, our emails will be available if you'd like to reach out and have any questions. Here are our references, and we are happy to answer any questions you guys have.
Well, thank you so much for everyone for your insights and research. We would now like to give the opportunity, as Maddie mentioned, for everyone to ask questions to our speakers. You can raise your hand so we can call on you to mute your mic, or you can type your questions in the chat box. So we can do that now.
First of all, very well done. This was highly informative. I just had a question, and I apologize if you don't know the answer. For the panelists. So sorry that you couldn't hear me. First of all, well done, panelist. You did fantastic. And I apologize if you don't know the answer to this question. We have a local treatment center here who is handing out fentanyl test strips. And I was just wondering, do you know if those fentanyl test strips are also automatically testing for xylazine, or would we need to look into kind of that dual testing strip? I'm not super familiar with that risk reduction process. My colleague handles most of that, so I'm just curious.
Yeah, great question, Jamie. Thank you. So fentanyl test strips do not in and of themselves test for the presence of xylazine. There are xylazine test strips now available for harm reduction purposes. You can look into those. In fact, that's something our lab is considering doing a research study about. However, I would look into the literature surrounding them, because the efficacy of those xylazine test strips has been less than the fentanyl test strips have come to be in more recent years. So while fentanyl test strips are, in the upper 90% of accuracy, we've gotten reports that xylazine test strips are not that high. And so I would just be cautious on branding that you buy or, looking into the literature. But no, fentanyl test strips definitely do not test for the presence of xylazine at this time.
Thank you. That is really good information. I appreciate all of that.
Well, thank you for the question. And then if maybe we can get one more question, if there's anything clarifying that we're wondering about.
I had one question. Natalie had mentioned, offering access to prepared pamphlets and other educational materials to hand out with some of that harm reduction material. So I was just curious where people could access, or if there are any prepared pamphlets and educational materials existing or templates that people could replicate that you would recommend?
Yeah, great question. To my knowledge, there are not any, our lab doesn't have any prepared right now. We have a contact at the Ohio Department of Health, kind of working on, when more can be done at the state level. The ODH is looking at potentially producing xylazine pamphlets that could be handed out. But yeah, as of right now, there are none, and I don't know if my colleagues know of any. But yeah, it was just kind of like a broad recommendation, I guess.
Yeah, it's great. And I know that people run into that problem a lot of just the pamphlets and materials aren't ready to go, and it can make a hard task even more difficult. So I was just curious if you had any resources. So thank you.
Yeah, thank you.
Sorry, can I ask another question regarding the xylazine test strips?
Yeah.
I know previously in Ohio, the fentanyl test strips were considered paraphernalia before they were decriminalized. Does xylazine fall under that same category for the test strips? Do we know?
Sadly, no, it does not. The law change in Ohio was explicitly for fentanyl test strips alone. And so any other kind of drug test strip is still considered paraphernalia at this time. Hopefully, a political or advocacy response will get that changed in the future. But you definitely want to consider that if you're going to consider handing them out.
Perfect. Thank you so much.
You're welcome.
All right, well, for the sake of time, I will go ahead and move on here. As a reminder, today's slides and recording will be posted on the COP-RCORP website in approximately 1 week. If you enjoyed today's session, we encourage you to consider viewing the replay of our 3-part series on gabapentin misuse and prevention that can also be found at this link below. And a little bit of closing housekeeping. I see that many of you have done this, but for attendance, please enter your name into the chat. Again, if you are seeking prevention or CHES CEs, please include your license number with your name. And another reminder, you must attend at least 90% of the session and complete an evaluation within 4 days. Failure to do this, you may not receive your CE certificate. And then lastly, we have our evaluation survey here. You can go to this link or scan the QR code. And I would like to thank our partners at Prevention First and the OCAM Network for providing prevention CEs. I would also like to thank the Ohio Center of Excellence for Behavioral Health Prevention and Promotion for providing CHES CEs. And after you've completed the evaluation, you can log off, and that will conclude our presentation today. Thank you.
Thank you, everyone.
Thank you.
Thank you.